Hello, everyone, and welcome to an amazing, informational, and fun presentation about the MedFit Network, what fitness professionals need to know and beyond. And my name is Christine Conti, and I am joined by the amazing
Mark Nutting. Such a good cue. Thank you.
There it is. And we are here to give you a lot of information today about why finding a niche and getting involved with the medical fitness world is so important and so very much needed. So what we're going to do right now is share with you a lot of our knowledge that we've learned throughout the year, knowledge, experience, and hopefully you will understand all about why it is important to be a part of the MedFit Network and how that is going to change lives. So with that said, we're going to start, and I want to introduce Mark Nutting, who is going to be talking to us today about building a successful business. So Mark, I'm going to hand it to you for a moment.
Thanks, Christine. It's one aspect to know your stuff, know your specialty, your personal training knowledge and information, and we'll talk about medical fitness specifically. But it's a whole other thing to be able to then market it and sell that and essentially get clients. And I've been a personal trainer and health club manager for 41 years. My specialty in the last decade has been in fitness business. I wrote the Business of Personal Training, which published in 2018, and I'm also the founder of Fitness Business Specialist Certificate Program. And so we're going to get into some business along with what medical fitness is in itself.
Beautiful. And I'm Christine Conti, and I happen to be the Director of Memberships and Outreach right now for the MedFit Network, in addition to a 20-plus year veteran in the fitness industry, former investment banker, former educator, and the author of the Arthritis Fitness Specialist course, and also Eating Disorders, What Fitness Professionals Need to Know, as well as an author, speaker. And I'm here to kind of share with you the importance of specializing, how it can, as Mark said, grow your business. As much as we fitness professionals have a big heart and we want to help people, we want to change their lives and improve their fitness and overall wellness, we also have to have a business model. And we also need to make sure that we are paying our bills and we are growing our business and clients and brand. And the MedFit Network and medical fitness is the future of fitness. So we're here today to kind of give you a lot of information and also break down what is the MedFit Network and the mission, which is there's millions of people right now with chronic diseases, disabilities, and they don't have the resources to be healthy, to be fit, nor do they even know what that looks like. So what we plan to do is make sure that the fitness industry can offer resources to those with the greatest needs. Now, about 80% of the people in the United States, they do not belong to gyms. They are not working out every day. They are not the fit. In fact, more people have comorbidities out there than those who are actually working out, or whatever that means, keeping in shape. And we know that through research, exercise leads to healthy, happy lives. And it decreases the chances for various chronic diseases, decreases the symptoms of disease. But who's out there working specifically with these demographics? And that's the problem. So enter the MedFit Network, because we are here to be a solution, or at least one solution, to this challenge. And what we're going to do, and we're going to talk about this, and Mark is going to cover some really important why behind the reason why we're doing this is because the MedFit Network offers a free directory for people to find fitness and allied healthcare professionals that can work with a niche, that can work with someone with a certain chronic illness or disease that has a background, that has a specialty. Their education is specifically to Alzheimer's and arthritis and cancer and Parkinson's and beyond. So we're here to empower and educate the fitness professional and bridge the gap between the fitness and medical professions. So with that said, we want to help you build your credibility in your community and beyond, offer you professional, searchable pages off of our website, and provide you with courses and the education and webinars and all of these resources that are needed to grow your education, to grow your reach and work and help certain clients. So with that said, Mark, I'm going to hand this to you about how the fitness industry has changed, because it has in many ways.
Right. And through the years, the past few years, I mean, the community at large has changed really what they're looking for. It used to be, if you go back to the 80s, it was all about the body beautiful. It was really about how I look, getting the six-pack abs, everything. In recent years, that has been changing. People are more concerned with being healthier, feeling better than they are about looking a certain way. And since COVID-19, the lockdown, health has become even more on people's minds. So they are absolutely looking more for health and function and independence than they are for that perfect body. If we look at what ACSM, the American College of Sports Medicine, does a survey every year, and they've looked at the top 20 worldwide fitness trends for 2021, exercise as medicine is number 7. Fitness programs for older adults, number 9. Health and wellness coaching, number 11. Lifestyle medicine, number 18. So you can see that even in the trends in the world, exercise with special, looking at medical fitness, looking at the health benefits of fitness, as opposed to, again, bodybuilding and or sports performance. So what kind of things are people concerned with? What are the health concerns? And according to the CDC, 60% of adults in the US, this is adults, not older adults, adults in general, have a chronic disease. 40% have 2 or more chronic diseases. 23% of all adults in the US have arthritis. And again, this is adults, not older adults. So keep that in mind. According to the American Institute on Stress, 77% of the people experience stress that affects their physical health. And, again, you're looking back at this past year and a half with COVID, that stress is even higher. Everybody is experiencing stress these days.
I'd like to jump in and say that these numbers too, with the CDC, they are only increasing. This is not a, open your eyes, see these numbers. 60% of adults have a chronic disease. And, for those of us out there, a chronic disease is something that does not just last, I have a certain pain and it'll go away, or it's, lasts for weeks, months, years, the rest of your life. And what type of quality of life are you living with 60% of adults with a chronic disease? What is it like to function every day, to live independently, being in such pain? I mean, no wonder why people have such, issues with mental illness, because the correlation between chronic disease and depression and anxiety is, they're hand in hand. So this certainly is just staggering to take a look at. So Mark, what is the medical community doing at this time?
That's a great question, Christine. The fact is that of the physicians who actually address physical fitness, the extent of it really gets down to, they tell the patients to get more exercise. And sadly that, when you say that, that's so so generic to an individual that they really don't know what to do, and it's not very actionable. They're not going to be able to take action on it. Maybe they start a walking program or something, but it's really not going to get any more specific than that. One of the challenges is, of course, is that the medical community doesn't really understand, the specifics of a fitness program. They don't understand the frequency, intensity, time, and type, and what it takes for that individual to become more fit and healthier by using exercise and nutrition. Another challenge is that most doctors don't have adequate time. Oftentimes they're really limited. You have 15 minutes to deal with each patient. There's a quota that they have to meet on a daily basis. And if something's going to get cut, it's usually, that fitness information. So they are doing a very limited amount of fitness discussions with their patients.
It's sad, yet it's, the research is there and it's fascinating. And I would challenge everyone right now listening to this to think about, have you ever had a conversation about fitness with your doctor? And if so, what specific information did they give you? Because, when that doctor says, you need to lose weight, you need to eat healthier, you need to, be more fit. Well, do I just go down to a gym and go to a generic trainer with a 2-day, certification that he or she got online? And is that going to help my advanced Parkinson's symptoms? That's frightening to think about. So what happens here with the fitness industry? If it is, a prime position after primary treatment, what do you suggest, Mark?
The fitness industry is really in a prime position right now to pick up after primary medical treatment. And, we're not trying to step in, we're not diagnosing, we're not taking, stepping on the physicians and or whatever therapy they're dealing with after seeing the physician. We're picking up right after that and helping them transition into exercising for the rest of their lives to stay healthy and fit. One of the problems in the fitness industry is that baseline certifications are all about working with a healthy population. It's not a specialty, where you can work with somebody with diabetes or, anybody with any of these chronic diseases we were talking about, or even special conditions, orthopedic issues. There are specialty certifications out there that you'll see, like special populations and medical fitness specialist. But even those are a huge umbrella for a billion different cases. And so that you're still not getting enough information about any one particular disease or condition. In the next slide, you'll see that we have, this was actually one certification that I just went through and grabbed what they're going to teach you. And if you look at this, it starts with chronic heart failure, atrial fibrillation, pacemakers, implantable vertebral defibrillators. Okay, it's a specialty just to pronounce these, but it goes on to multiple sclerosis, Parkinson's disease, muscular dystrophy. How can you be a specialist at any one of these things when you have so much there? So what we really need to look to for specialty education is to find the niche that we want to work with. Which one of these? Christine, why don't you take it from here?
So I want to think of one of the best analogies I use is that if something were to happen and you break your nose, who do you go to? Do you go to a podiatrist? No, you're going to go to a facial surgeon, a facial reconstruction specialist. And I don't understand why in the fitness industry, when people say, why are we not taken seriously? Why is it not easier to bridge this gap? It's because we have to specialize. Just like a general doctor, family medicine may not be doing your heart surgery at Sloan Kettering in New York City. It's specializing. And that's what we have to look at in the fitness industry if we do want to be, to elevate our career and to really make sure that we have the education behind us. And when we talk about diversifying your career, it's what are you doing to specialize? Are you saying, I don't just want to be a personal trainer, I want to be a Alzheimer's fitness specialist, as an arthritis specialist. I work with people specifically who suffer from various forms of arthritis and autoimmune diseases. That is how I've diversified my offerings. And really, Mark is going to talk in a moment about the niche. Niche is where it's at. And you are going to be more valuable to your clients. You are going to be able to be more valuable and have more business and professional opportunities in front of you. And, many people look at, hey, I should get more education. It's not just maybe I'll just take a random course. It's time to invest in education, invest in that specialty you really want to learn about. And that is what is coming forth with the MedFit Network. And what happens with the MedFit Network is that we have something called the MedFit Classroom, which is an offshoot of that, which offers specialized education that is reviewed by doctors, that is based on research and evidence-based studies, so that you can then implement this into your career. So some of the things that we're looking at right now is certification, certificate programs, internships, in-depth studies, all of it. And this is what is so special about the MedFit Network, giving you that notoriety, giving you a platform to be searched. And now the MedFit Classroom is giving you the education to best help you specialize and find that niche. Do you want to add anything to that, Mark?
Well, actually, it's a complete aside here. I've been talking about the importance of having a niche and really getting really trained well in that one particular area for a long time. And, the complaint I was having about the general or the things like special populations, I've been, that has never for me stood out as being something really valid, because there are too many things that fall within that umbrella or underneath that umbrella. And it's only recently that I've gotten involved with MedFit Network and MedFit Classroom. And it specifically, what I like about MedFit Classroom particularly is the idea that they really have broken down these specialties. And now you really can be a specialist in this area. And so I wanted you to, I'm saying this because I'm not selling MedFit because, they're paying me to sell MedFit. I have believed in this for a long time, that you need to have that niche training specifically, as opposed to some generic, I'm covering all the medical conditions in the world. So the fact that they came out with them is just one of the biggest reasons I support them. This is important.
I'm going to say, I agree, Mark, wholeheartedly. And I want you to talk a little bit about, targeting your market. A niche is huge. And again, like we said, the MedFit Network is that niche. We're not looking at trying to take 10 seconds off your marathon time here. This is not about, how much weight can we lift? And like you said before, the fitness industry, it was about being strong. It was about being sexy, right? It was very much this flashy industry. And right now, with all the research behind it, it's about, let's live quality lives. If our lifespan is getting longer, well, how many years of those extra years we're living are we confined to a chair? Are we sedentary? Are we just compounding those comorbidities and being on more medications? Let's add some quality to our years, not just years to our life. And after, we start thinking about the niche, which is so needed, this medical fitness out there. So let's talk about building your business. And you are like the bee's knees, Mark, when it comes to talking about some of this. So marketing medical fitness. So, all right, so maybe I do want to specify in Parkinson's, Alzheimer's, arthritis. Well, now that we've picked one, now what?
The fact that you have this niche, I mean, usually a personal trainer or fitness professional chooses a niche because they know somebody who's dealt with this particular disease or condition, or maybe they have it themselves. A good friend of mine has MS, and he then became a specialist in MS because he had done such a good job in managing medication, his own medication, and talking to doctors about how the fitness worked. So that personal is important, but that also is a starting point for us in marketing. If you have clients or individuals that you know that are dealing with this disease or condition, that's where you start with your current clients, family, friends. That's where we move on to and let them know about your new training. Next slide.
All right. So wait a minute. Wait a minute. What about marketing to doctors? Let's do it.
Okay. The idea about marketing to doctors, prior, years where, the industry has talked about getting to the doctors a lot for many years, again, without any real plan and very generic at the time. But the idea was always, how do you get in to talk to the doctors to get them to refer to you? And the problem is that doctors shouldn't be your first outreach. You don't have a relationship with them. Cold calling is not something that's going to work. How do you get in touch with them if you want to? It's not directly. It's going to the patients. If you've ever, I actually watched network TV because I don't usually, and I was surprised at the gazillion drug commercials that were on TV. And, the drug commercials are not for the doctors. The drug commercials are for the patients to go ask the doctors, because they have pull with the doctors. And, if the TV ad says ask for it by name, they're marketing to the patient to then go to the doctors. And they wouldn't spend the hundreds of, millions of dollars on this if it didn't work. So it works to go that route. And that's what we're doing, is we're going to first go to the people who have the condition or the disease and get from that introductions to the doctors.
And it's the same, I would say that is the same marketing technique that, if you are a great restaurant, guess what? People are going to spread the word. I don't get paid by my favorite restaurant, hairstylist, products that I use, although I'm open for it. But, why are we thinking that we have to reinvent the wheel as fitness professionals? And people ask me all the time, Christine, does MedFit market to doctors for us? Are they going to, well, who are you working with? Do you have a specialization? Because guess what? Your specialization will speak volumes to people in your area. Those people in your area, if they love you and they know you are educated and you are a MedFit specialist and instructor, they are going to sing like a bird to their doctors. And that, what you just said, to kind of reiterate that, is so valuable to have that referral base. So letting people know about you, what is your niche, like you said, is huge. So what would you say about getting in front of those people then, Mark? How do we find them?
Well, once we initially have the ones that are directly connected to us, there are other ways you can go. There are support groups that you can then ask your clients, your friends, your members who either you've worked with or know that you have that specialty. And if they're going to a support group, we'll use a cancer support group as an example, then they might be able to directly refer you to anybody who's looking for help in the fitness area. And if that's not the case, they could probably hook you up with whoever's running the support group. And if they introduce you, you have an in, and at least you'll have an ear for that support group leader. And what could you do for them? It's really about creating value for them. It's not, you're not going out there and just asking people, come to me, come to me, come to me. It's about, what can I do for you? How can I help this group? And maybe it is doing a short presentation on how people can get more fit and how it helps their particular condition. It's been, in cancer, cancer patients who are dealing with chemo do much better when they're also exercising. So information like that is very important to pass on. And again, a short presentation, or maybe you can even offer to do workouts at that support group, just a short, 5-minute workout. Here, let's do this movement series together. So creating value for them. And that gives you the opportunity to get in front of your target market. And that's exactly how you gain clients, is when they get to know, like, and trust you. Now, what if your current clients, friends, or whoever else that have that condition or disease don't go to support groups? Well, you can still look up support groups. Go online and just Google it. My wife has cancer. She's has stage 4 lung cancer, and she doesn't go to a local support group. So if I wanted to do cancer exercise here locally, then I need to Google, using Google as the verb, I need to Google local cancer support groups. And there are some. And from that, I can contact whoever's running the group, find out when they meet, ask if I could join them, and do the same thing, offer, a presentation, offer workouts, but getting in front of your target market.
I'm going to piggyback off of that and say that because people know that I am a huge advocate of medical fitness and have immersed myself in, being a specialist in arthritis or working with cancer patients, people have passed my name around. And I actually work with a nonprofit that is a huge, cancer, it's exercise through cancer, curing cancer through exercise is the mission. And I've been Zooming and teaching them a workout once a week since, in the past 2 years. And that is because of, again, word of mouth. I am a part of this movement. I'm a part of supporting, and fighting disease through exercise. That's really how this happens. And, that is a snowball effect of, this is my passion. This is my niche. I have this education, and it's needed. It's so needed out there for so many people that I think sometimes we don't realize how powerful that is.
Right. And, that education, that information, you're talking about how that's needed. There is so much misinformation too out there that, people are desperately looking for information, and we need to give them a resource where they can get accurate information. And again, if we're supplying them the information that is appropriate, research-based information, they are going to start to trust you with that, and they'll look to you for that, to be that resource. Again, coming down to, people want to work where people they know, like, and trust. And you build trust by giving them their accurate information, and helping disseminate that, and letting them know what misinformation is out there. And it's amazing to me, when people have conditions and they will just latch on to any trend that's out there. So we have to step up and really be the voice.
You mean there's not just a pill that I can take that would cure everything?
According to some, there might be, but that's not what the research says.
science, Mark. It gets you every time, I feel like.
I know.
You know, what, just to reiterate this, online support groups right now, post-COVID or COVID, whatever's going on, is huge. And people are seeking people that not just to work in person, but still continue to work online over Zoom around the world. And I think this is really important. Like you said, the like, know, and trust. And, you know, training online is huge right now. And people are making a great living in this capacity because many people, like we talked about, these special niche or this niche that's out there, if you do work with people with, I'd like to say arthritis because that's my specialty, guess what? You're immunocompromised. Those people may not want to go out into a public space. And now you've created a business based on your niche of being online, working home. And that's something I think, you know, is unbelievably helpful. And if you are home, it gives them a feeling of I'm not just existing, but I'm living. I have someone that is, you know, really catering to me and my needs and knows what I'm going through. And that in and of itself, not just physically, but mentally dealing with some of this is big as well. So, so what about the information you share? And I know we talk about MedFit, but we also talk in general.
Right. You know, I mean, first off, for people to get to know, like, and trust you, it's nice to have original material created for them. Maybe it is, you know, you've written an article, blog posts, you've created videos. Those are all really, they give the audience, your target market, a better sense of who you are. So in the sense of getting to know, like, and trust you, you know, your original content hits home. But that's not the only way. Some people will say, well, I don't like the way I look on videos. I can't, I'm not a good writer. You know, I'm not effective at that. Well, okay, so curate that. Find the information that is important to them. You know, and again, on MedFit Classroom and in the MedFit Network, you can find all kinds of information and pass that on. But research in general, you find that, you know, you want to dive into your niche and get as much information as you can. Look online with the caveat you're looking for research. And there is a ton of stuff in journals out there that you can access for free and get deeper information, get more in-depth information there. Sometimes, you know, it's a little too technical, and you can, one of the things you can do is tag that journal article and then translate it for them, you know, put it in layperson terms. So what this is saying is that, you know, it's beneficial to do this, this, and this. So you're curating content, and that also allows you to be the resource, the go-to person for information about their specific needs. And that's very important, you know, sharing that information. Again, building value in a relationship with you.
Oh, absolutely. And marketing to doctors, I know we did speak a little bit about this, but is there anything else that you think of when we're talking to doctors that is super important now that maybe their patient has said, oh, Mark is so awesome, this MedFit instructor has got this specialization? What do you recommend at that point?
Well, ideally, you'd like to sit down with the doctor. And, you know, so if your client talks you up and, you know, you can ask them to relay to the doctor that you'd like to sit down with them and talk about the client's program, your clients, their patients. And your first meeting with them through one of their patients, your client, it should be about them, not about you. But in talking about them, you want to explain how you created the program, what you based your information on, how you developed that. You want to show them your client's chart, the progress that they've made, and, give a copy to the doctor along with your resume and say, this is what I do. And I just, let's talk about how we can have an ongoing discussion about my client. And, the client will have to sign a permission for the doctor to talk about them, because, that's confidentiality. But, to stay up to date, and, the doctor's going to be really happy with progress. You're making progress, and that's just great. And the doctors are usually thrilled. Again, they're unable, or, either through time or knowledge, to get into the specifics of a program with the client. So to have somebody that's helping their patient, do better, they really do appreciate that and like that. And so that meeting with a doctor is your chance to say, this is what I've been doing with this client and the progress that we've made. And I'd like to continue our relationship going forward. So it's getting that referral from the client.
And I think that bleeds right into the idea that we are not, I don't believe that it is out of the realm of, projecting that, eventually doctors are going to be writing prescriptions for exercise. And that is the entire goal of bridging that gap between the fitness and medical world of, we trust you, you're educated, you have this knowledge, you have this specialty, and now we feel comfortable handing off. And you spoke a little bit about this before, about, approaching a doctor. No one wants to be pitched. Okay, if you want to go on to social media for people to cold call or cold reach out to you, it's important to establish, like you said, the relationship. And now, what about the rule of reciprocity? What do you think about that?
Well, that's the important thing to know about that is really that you're coming into well, let me back up just for a second and say that, if you're not being referred to by your client to the doctor, and you really are sort of cold calling them, it shouldn't be about you. It should be, I want to find out more about you as a doctor and what you do, because I'm looking for somebody I can refer my clients to. So this is really a term called reverse marketing. What you're doing is you're trying to find somebody who you would be comfortable referring to. We do this, since we need to refer out for, injuries and everything else. Maybe I'm looking for an orthopedic doctor to refer patients to. I want to know who I'm referring to. We don't want to just refer generically. We want somebody we can know, like, and trust, as that works. But it is a physician. So I need to know more, particularly, I moved into a new area and I knew no doctors and had to start creating a network of people I could refer clients to. And so the thing is that as you try to go there and talk to the doctor, and just say that I'd like to sit down and know a little bit about you so I could refer clients to you, they're much more likely to sit down with you and give you the time. Rather than you going to them and saying, I want you to refer clients to me. But if you do refer to them, as you were talking, Christine, about the rule of reciprocity, if you're referring to them, they're going to feel like it's important for them to refer back to you. And they will. And that's a huge part of a relationship with this physician, is creating that relationship. So it is a back and forth. If you get to know each other and you trust each other, then you will refer back and forth. And that's a huge way of getting your target market referred to you from doctors, is to first think about who you're going to send them to and find out more about them.
I think that's actually a life lesson you just talked about, Mark.
Sure.
That is a life lesson. So when he just talked about doctors, think about that as clients. Think about that, who's your ideal client? Right? This is what we're talking about. I don't want to work with children. And that's okay, because I work with adults with arthritis and autoimmunes. That, there are people that are specifically targeting youth fitness. and youth obesity and whatnot. And that is their target. And I think it's important to say, I want to work with you, you want to work with me because this, and you lay that out there for them. So building your professional network, I think that we can say this very confidently, that specialize in your niche, disease, or condition. Very important. And that's going to be who you want to reach out to. That's going to dictate, where you're going to spend your time and research. If you're someone who specializes in eating disorders, you're going to want that, the registered dietitians and, maybe even psychiatrists, psychologists that you know of, that you can outsource. The same thing with, an orthopedic and chiropractors as well. And this is the beginning of great relationships, as Mark said. So really important. Go ahead.
No, and just adding on to that, you want to have this network that you can refer people to, but when you're dealing with a specific niche, you also want to realize that they all have a niche as well. One of the things we found out is there are therapists who deal specifically with oncology patients. There are dietitians who deal with, people with cancer. There are, every one of them has a niche, and you want to find the one that is the best match for your people. If they have cancer, they have arthritis, they have whatever, which one of these professionals specializes in that? That's just what we want them to do that to us. And we want to be able to do that to, where are we sending our client?
Right.
And where are they sending their patients? It's all about that specialty.
So let's go over the checklist of what we talked about today. I know it was extensive. I hope that you all got a little bit of information and maybe a little bit of inspiration as well to go out there and really go for that niche. So our checklist is: number one, join the MedFit Network. Choose a medical fitness niche. Increase your education, and that's through the MedFit Classroom. So you can take a specialization course. So the list of everything that we talked about before, there's going to be about 30 specialization courses coming out in the near future. And then we've got to let the world know, what is it? What is your niche? What do you specialize in? What's your education? And talk to your clients. The clients are your best marketing tool that you can possibly have, because if you provide them with value, they're going to sing your praises. So get the testimonials, ask for referrals, and network, period. And that's what we're here for. So the MedFit Network is here to help you network with other fitness and medical fitness professionals, to get your name out there, to grow your education, and help improve you and your clients reach their goals. So medfitnetwork.org. And with that said, if you would like to get in touch with me, all of my information is included right here: social media, emails, websites, you name it. So go ahead, and you have a copy of this, take a snapshot, download it, whatever you need. And of course, the amazing Mark Nutting, all of his information is here as well. So with that said, Mark, I super appreciate all of your amazing information about marketing and finding your niche and growing your business and changing more lives. So thank you so much for sharing this.
Well, thank you so much, Christine, for having me.
Beautiful. And for all of you out there, reach out to us. We are here for you, and have a wonderful day.